Hey, Justin.
Let's get going. Yep.
Yeah, let's get going. All right. Well, welcome to our seminar this evening. My name is Doug Lubenow. I'm the president and founder of Senior Advisors. Been specializing in Medicare for about 15 years now. I've been in health insurance for 32 years in New Jersey and stuff. Justin joined me about 6 years ago. He's just hitting his 6 years in the business with me after 15 years in corporate America. Rod, he's one of our Medicare specialists that works out of Justin's office and very successful and does a great job for us also. So that you'll have the three of us this evening on this seminar. The purpose of the seminar tonight is strictly an educational seminar. We're not here to sell you anything. We are just here to educate you how Medicare works, how it coordinates with Medicare supplements and Medicare Advantage plans, the differences between Medicare supplements and Medicare Advantage plans. So again, it's strictly going to be educational. If you do have questions, use the chat box. Right, Jesse, you use chat box or Q&A?
Q&A.
I'm sorry, use the Q&A. Sorry, I'm giving a bad instruction. Use the Q&A and we'll be answering questions as we go along. So don't hold back, because if you have a question, probably 2 or 3 or 4 other people in the room have the same question. So please, we want to have this, be educational, but also answer your questions. So tonight, let's go to the next slide, Justin. All right, so the Senior Advisors was founded, 2009, but I've been in the supplemental Medicare business for 15 years and been very active in the health insurance business. Been going to Washington for 30 years, lobbying on healthcare issues, and Justin has come down every year. He's been on board for 6 years and been very involved with CMS and HHS over the last couple of years, and he has some great contacts down there if we need any assistance with anything at CMS. So it's been great. We have offices. We have an office in North Jersey, Cranford, and one down in South Jersey. And we just recently opened an office in Phoenix, and I am going out to that Phoenix office tomorrow for the Thanksgiving week and tie in a little work with holiday celebration with my other son that lives out there. We're in over 30 states throughout the country, so we can assist people in most areas of the country. We do a lot of business up and down the East Coast, from Florida on up north, in New York. So we do have contracts with every state that we're in, licensed to do business in every state we're in. We work with all the major insurance companies. We work with Aetna, Cigna, Mutual of Omaha. Some of the Blue Crosses we can work with, and some we can't. Anthem Health, I believe in Connecticut is the big one. Anthem and United Healthcare are the two biggest supplemental companies in Connecticut, and we do work with them. So, we help our clients, get set up with Medicare and Part A and Part B, and then we explain the differences between Medigap and Medicare Advantage plans. And then we're going to get into the Part D drug card, which is probably one of the most important decisions you can make in making sure you have the right drug card every year. And that's what we're doing right now. For the last 2 months, we've been reviewing drug cards for our clients. We just did over 1,500 out of my office, and Justin's done over 1,000 out of his office. I think we saved our clients about $3 million this year. Every year it's about $2 to $2.5 million. I think this year we saved them over $3 million by reviewing the drug cards and making sure they don't stay with a drug card that's not going to be beneficial to them next year, and get them in the right drug card for next year. So we're going to talk about Medicare and how that coordinates with Medicare supplement. We're going to talk about Part D drug cards, and then we're going to recap this with the biggest mistakes that we see people making on Medicare and not understanding what they're doing. So the parts of Medicare, you got Part A, which is inpatient care. It's hospital care. It's for inpatient hospital and also for skilled nursing facilities, hospice care. There's usually no premiums on Part A. As long as you work 40 quarters in your lifetime, Part A will be free. As long as you worked and paid into the Medicare system, Part A is free. Part B is everything that takes place outside the hospital. So it's all your doctors, it's hospital, outpatient care, durable medical equipment. So that's all under Part B. And Part B, they just announced the premiums on Part B for next year. It just came out last weekend. It's going to be going up to $170.10 a month, which is the base amount. And it is income based. So we're going to get into that next slide. We'll get into, what some people pay more than the 170 based on their incomes. Part C, a Medicare Advantage plans. It's a whole different format of using Medicare. You're not using your Medicare card. You're going to use an insurance company's card. And they're going to be, taking care of you, and you'll take like an Aetna card or a United Healthcare card, Blue Cross card, and now have all your benefits in that one card. You don't need your Medicare card any longer, but it's a totally different type of insurance coverage that we'll get into a little bit more detail. And then the Part D is you get your Part D drug card from a private insurance company. It's a separate insurance company, so it's not given to you by the government. You get A and B from the government, but Part D is a drug card that there's usually 25 to 28 drug cards in every state, and we review based upon the prescriptions you're on. There's a tool that we use. It's in the Medicare system, but we use this tool, and it tells us which drug card is going to be the best for you for the coming year. All right, so what do you pay for Part B? So this chart shows you, the left part of the chart shows you where we were in 2021. In 2022, again, these numbers just came out last week. And you can see that they made some increases. So if you're single, making 90, now they're going to look at 2020 tax returns to come up with these numbers. So if you were single filing and you did under 91,000, or if you're a couple filing jointly and make 182 or less, it's the base amount. It's $170.10. But there's 6 income brackets for this, and this is a surprise to a lot of people. So as your income is higher, and again, they're looking at 2020, and if you're, in that 182 to 228 as a couple, it's 238. It keeps going up. The second highest is 340 to 750. It's 544, and the top bracket is 750,000. You're going to be paying $578 a month, and that's for Part B. But that's not the only thing you're going to be paying, because there's also, these are called income adjusted amounts that the government's going to attach to your basic Part B. So you also will get an income adjusted amount if you're over the 182,000 as a couple or 91,000 as a single. There'll be an income adjusted amount on your prescription drug card. So if you're under those limits I just mentioned, you don't pay anything extra. You will pay a premium for the drug card to the insurance company that you get the drug card from. But then the next level, it's only an extra $12 a month, but it goes all the way up to an additional $77.90 if you're at the top income bracket. So you have to add these numbers to what we just showed you under Part B. So the total that you might have to pay, again, the total can be 170 if you're under the 182 or the 91,000 as a single, but it can go up. Every bracket goes up about $100 higher. And again, the top bracket, $656 next year is the top bracket. And, people get surprised by this. I was with a friend this weekend, and he just turned 65, and he signed up for A and B, and he owns his own company. He makes well over $750,000. And I said, you're going to get banged for $656. And he's called up Social Security immediately, and he got the form that he needs to reject it. His wife has been on Part B for 2 years, and he can't believe that she's been paying these higher rates, and he's going to cancel hers out because he's got at least 2 more years left working for his business that he doesn't need to pay the Part B because he has group health insurance. So what happens if you retire? You're making the $400,000 now, and you retire, and you say, well, I'm not going to make $400,000 in retirement. My income will drop down. Well, you can get in touch with Social Security. When you get your form right now, it'll come out in the next couple of weeks. The Social Security will tell you how much you have to pay next year based upon what your income was 2 years ago. And if you're not making that income any longer, you have the right to appeal it. And it tells you in the letter, it gives you all these reasons why you can appeal it. Work reduction. Well, if you're retired, that's work reduction. So there's reasons that you can appeal and say, well, I'm not going to make 400,000 any longer. I'm going to be retired. I might make 200,000. As long as you have a way to justify what you think you're going to make, you can go to Social Security and appeal it. If you're going to be below 182, you'll be brought down from whatever it was, 400 or $500 a month to less than the 170 base amount. So you should definitely appeal it, and Social Security will adjust your Part B. You don't have to wait 2 years for it to come through in the system based on the tax returns from 2 years previously. So when should you enroll in Medicare? This example here is somebody with a birthday September 10th. First of all, I do want to say, if you're working for a business or the company with 20 or more employees, your group health insurance is primary. So there's a lot of people on here today probably that might still be working, they might be over 65. And if you're working for a company with 20 or more employees, you do not have to sign up for Medicare Part B. All right, so don't waste your money. You have group health insurance, you don't need it. So when should you sign up? If you're turning 65 and you're not working with group health benefits, so you should sign up 3 months before your eligibility month. So this example, September 10th is the birthday, so September 1st is the month of eligibility. So you can sign up in the month of June. So June or July would be a great time frame to go online at socialsecurity.gov, ssa.gov, we'll give you that a little bit later, and sign up for your Medicare benefits. So 3 months before, and you can still be in your initial enrollment period 3 months after your eligibility month. So you could go as late as December 31st and enroll for Medicare and not be penalized. If you do not sign up for Medicare when you're supposed to, you will be penalized 10% per year, and you won't be able to get in until the general election period, which is January to March, and they postpone your enrollment until July. So, you know, a lot of people have been hurt by this. I have someone right now that lost their benefits in July last year, never took Part A and B, they should have had it. They can't get in until January and they won't get benefits. So he has no health insurance other than Part A of Medicare until next July. So hopefully, you know, he doesn't get any type of major sickness where he needs Part B because he has nothing to cover him. The only problem is that the longer you wait after your eligibility month, the longer they're going to make you wait to get your Part B. So if you wait 1, 2, or 3 months after your eligibility month, they're going to make you wait either 1, 2, or 3 months. So example, if you wait 3 months, you're not going to get it until 6 months after your, you know, eligibility month, because they're going to make you wait an extra 3 months. Now, this has been a problem for a lot of people for years. A lot of people, we've had a number of people that want to continue working, and 2 months after they're 65, for whatever reason, they've gotten laid off from their job, and they say, oh, I got to get Medicare now. Well, you're not going to get it right now. They're going to make you wait a couple of months. And now, you know, you should have had Medicare the next month. This is something we've been fighting in Washington for, I'd say, 4 or 5 years. And we finally got this changed, but it won't go into effect until 2023. But when it does go into effect, it's going to be a big enhancement, a big improvement for everybody, because if you enroll 2 months, 3 months after your your eligibility month, you'll get covered immediately the first of the following month. So you won't have this 1, 2, or 3 month waiting period because you applied a few months after your eligibility month. So again, nothing happens quickly in Washington, but this was going to help people. And it was just an old antiquated rule that was in Medicare, and nobody can explain why they had that rule. So who pays first? This is a question that comes up a lot. If you work in a small company and you have less than 20 employees, you do have to have Medicare A and B, because Medicare is primary. If you, as I said before, if you have 20 or more, if you work in a company with 20 or more employees, your group health insurance is primary. Now, it does differ if you have somebody on Social Security disability. Somebody on Social Security disability that gets Medicare, and you work with a company with less than 100 employees, Medicare is primary for that individual. So it could be somebody's spouse that has Social Security disability and they work for a company less than 100 employees. They better have Medicare A and B. If the employer has 100 or more employees, the group health insurance is primary for that Social Security disability person. If you're on a retiree plan and entitled to Medicare, Medicare is primary. Any retiree plan, Medicare is primary. You do have to have A and B because that retiree plan would expect you to have Medicare and Medicare pay first. The other one that we see that creates problems every so often is COBRA. People misunderstanding COBRA. They think that they're on COBRA. It's the same as the group health insurance. Yeah, the coverage is the same as the group health insurance, but you're no longer actively at work. So Social Security doesn't view it as credible coverage as employee coverage. So you do have to have Medicare if you're on COBRA. So, you know, we usually, in most cases, it doesn't make any sense if you're Medicare eligible to spend. I just wrote somebody, this husband and wife spend over $2,000 a month on their COBRA plan. The husband turned 65 and we got him off November 1st off the COBRA. So the wife is left for another year until she turns 65. She only has to pay $1,000 a month for her COBRA. So, you know, it's always beneficial to just get off of COBRA and go on Medicare if you're Medicare eligible. If you have already applied for Social Security, let's say at age 62, and then you turn, you know, you're going to be auto-enrolled in your Medicare card. You're going to get your Medicare card 2 to 3 months, 4 months sometimes before you're 65 years old, and you get auto-enrolled in A and B. Now, for whatever reason, if you had group health insurance and you don't want B, you have to write back and say, hey, I want to drop B. I do not want it at this point in time, and they'll take it off and they won't charge you for the B. If you're not enrolled in Social Security, then you do have to go online and enroll, and you can enroll at ssa.gov/benefits/Medicare. If you just go to ssa.gov, there's a drop-down menu, and you can just select, you know, apply for Medicare benefits, and just go through and apply for your Medicare benefits. Now, if you're over 65, you can't do this online because Medicare wants proof that you've had group health insurance since you've been 65. So there's a form that Medicare requires, and it's a simple one-page form that your employer has to complete. And if your spouse is also on the same group health insurance, then you have to get one for your spouse also completed to show that the spouse had group health insurance. So it's a simple form that the employer completes, puts the dates you've had group health insurance and the dates that you have been employed there. They sign it, and then you take the form with one other form. It's just your request to start Part B, and you can fax it into Social Security. We used to tell people to walk into the office. Hopefully, maybe in next year, they might start opening up the Social Security offices again, and you can walk it in, make sure you hand it to somebody. But it's worked pretty well, faxing it or emailing it to your local Social Security office. Next slide. Justin, there's a question. Did you want to answer it? I don't know if it's.
I don't see a question.
Okay, it's in the chat box. I guess it wasn't a question. All right, I'm going to turn this over to Rod. Rod's going to talk about, you know, Medicare and how it differs from Medicare Advantage plans. So take it over, Rod.
All right, awesome. Thanks, Doug. So we had a nice understanding now of Medicare, the different parts, but now we have a few choices when it comes to how you personally will want to get your Medicare coverage. We have two options here. On one side, we have Medicare Advantage, also referred to as Part C, which in essence bundles all of your Medicare coverage. So it bundles Part A, which is your inpatient hospital care, Part B, which is your medical insurance, so everything outside of the hospital. And then usually it also bundles in your Part D, which is your prescription drugs. So this puts you into a fully privatized insurance policy, more along the lines of an HMO or a PPO, similar to what you're used to through your group employer health plan. That's one option for getting your Medicare coverage. The other option is sticking with original Medicare and picking up a supplement. And how that works is basically just doing what Doug mentioned, enrolling into Part B when it's suitable for you. picking up a Part D prescription plan, which will go into detail further how you can find the most suitable Part D prescription plan for you. And that would be a standalone plan. And then lastly, decide if you want to get into a supplemental plan. That's also called a Medicare supplement or a Medigap policy. So instead of having a bundled plan like a Medicare Advantage, these would be all standalone policies that would be tailored to your specific needs. So what are some differences with these two options? So we have a nice little chart here. Again, we'll show the difference between picking up a Medicare supplement or going the Medicare Advantage route. First and foremost, how it relates to your Part A and B of Medicare. Well, with the Medicare Advantage plans, they actually replace your Part A and B of Medicare. Even though you still have to pay that Part B premium, you're no longer on original Medicare, which allows you the freedom to go to any doctor or hospital or provider that participates with original Medicare. Now you're in a fully privatized insurance policy. So Medicare Advantage replaces that option. Supplement does exactly what its name implies. It supplements your original Medicare. It works alongside it so that you still have that freedom to go where it is that you want to go. And which is highlighted in our next line. As far as private networks, original Medicare does not have any private networks. Right now, it's about 99% of hospitals and over 90% of providers here in the US and its territories that participate with Medicare. So if you have original Medicare and a supplement, you're able to go wherever you need to go. As far as Medicare Advantage, most of these plans will have a private network, again, more like an HMO or a PPO, where you have to go to the doctors in that network. For referrals, right? If you want to see a specialist or if you need to get a specific test done, with original Medicare, there's never any referrals required to see a specialist. And with some of these Medicare Advantage plans, they change every year. They add more and more options. Some of the plans actually don't require a referral, but many of them do require you to go through your primary care physician in order to see any type of specialist or get any extra testing done. So referrals are generally needed for a Medicare Advantage, whereas with original Medicare and a supplement, that is not the case. And as was mentioned, Part D, which is your prescription drug coverage. If you go the original Medicare route, you will have to pick one of the 25 Part D standalone Part D prescription plans that are available in your area. With Medicare Advantage plans, they have this drug coverage built in. So it's a complete package in that sense. We do see a bit of difference when it comes to these monthly premiums with these two different routes. Oftentimes, Medicare Advantage plans are provided at a very low cost. Perhaps you've seen the commercials. Oftentimes, they're $0 is what they tout. So a lot of these plans are provided at a very low cost to our Medicare beneficiaries, whereas these supplements are going to be a little bit higher. You're going to see a variety of premiums depending on your age and also depending on your zip code. So the premiums is where you'll see a big difference as well when it comes to these two coverage options. What about out-of-pocket costs? So these are things other than the premium. So basically copays, co-insurance, deductibles. With original Medicare, the out-of-pocket costs, these variable costs are very minimal. We'll go into more detail into what your out-of-pocket costs would be, but generally they're very low when it comes to a supplement other than your premium. There's not a lot of money that will have to be paid. Whereas with Medicare Advantage plans, there are copays, co-insurance, and deductibles all the way up to the federal maximum of $7,550. So that out-of-pocket, even though the premium's a little bit lower with those plans, that out-of-pocket is much higher. And as far as guaranteed renewability for life, so basically what that means is as long as you stay enrolled in a plan, it's guaranteed to be renewed every year. That's the case when it comes to these Medicare supplements. You don't have to worry about your policy being dropped or you being kicked off the insurance. As long as you continue to pay your premiums, you're guaranteed to be renewed every year. With these Advantage plans, that's not the case. There's changes every single year. Some of these plans will change everything about, not everything, but they'll change a lot of how their plans operate, as well as the doctors that are in the network, and you yourself can lose that coverage. So it's not exactly the same. So those are just some of the key differences between the Medicare Advantage as well as the Medicare supplements. So we're going to dive a little bit deeper into Medicare supplements. We're going to talk about 3 of the most popular Medicare supplements at this time. Plan F, Plan G, and Plan N. Now, Plan F is, for the longest time, referred to as one of the gold standard plans, because there was literally no out-of-pocket cost to you as a beneficiary other than your monthly premium. Now, Plan F is no longer available to those who did not qualify for Medicare before January 1st of 2020. So that doesn't mean you had to be enrolled in Medicare, but basically you had to qualify for Medicare before January 1st of 2020. So if that situation, if that's your situation, then you could possibly still qualify for this plan. So how does Plan F work? Well, we look at our little chart here again. Original Medicare, when it comes to when you're in the hospital, right? If you, the first 60 days, Medicare will pay everything except $1,556, right? If you did not have this Plan F supplement, you would be responsible for that $1,556. With Plan F, that Part A deductible is covered 100%. Now, if you're in the hospital for a little bit longer, days 61 through 90, it actually becomes a daily copay of $389. Plan F pays that daily copay. Now, for days 91 and after, that copay gets even higher, $778 each day. If you did not have a Plan F Medicare supplement, you would be responsible for that daily copay. But Plan F, as we can see here, covers that cost. As we mentioned before, Part A of Medicare also covers skilled nursing facilities, not long-term care or custodial care, but basically if you're transferred into a rehab center after a hospital stay of at least 3 days, Medicare will pay the first 20 days that you're in that skilled nursing facility. So all charges, those first 20 days are covered by Medicare. Now, if you have to stay in the skilled nursing facility a little bit longer, days 21 through 100, Medicare will pay everything except $194.50 per day. Plan F, as we can see, covers that daily copayment, and you're responsible for nothing. So how does Plan F work with Part B, right? It's our outpatient services. The first $233, that's referred to as the Part B deductible, which normally would be your responsibility. Plan F pays that Part B deductible. After that, Medicare will pay 80%, and then your Plan F Medicare supplement will pay the other 20%. So you're 100% covered for medically necessary services. And again, as we can see in our last column, no out-of-pocket expense for you. So that's basically Plan F. We'll move over to Plan G. Now, Plan G is exactly like Plan F. The only difference, the only exception when it comes to this plan is that first $233, referred to as the Part B deductible. So Plan G will cover everything exactly like Plan F, except that $233 deductible. So that will be the only out-of-pocket expense for a Plan G Medicare supplement. No matter who the carrier is, that is exactly how much you would be responsible for, other than your monthly premium. So that's Plan G. Now, Plan N is exactly like Plan G in the sense that you're responsible for that Part B deductible. So $233, the first, usually it's after your first or second doctor's visit, you'll get that bill. You're responsible for that amount. And Plan N also has copays, and they refer to these as up to $20 for an office visit. So you're seeing a doctor or a specialist. The copayment is up to $20. And the reason they say it like that is because not every doctor, not every office is going to charge you $20. Some will charge you $5, some $10, some $15, but the maximum amount they're able to charge is $20. And then up to $50, it's an up to $50 copay if you visit the emergency room. And that is waived if you're admitted into the hospital within those first 24 hours. And then lastly, the last difference, which is not something that's very common, is referred to as Part B excess charges. Basically, Medicare has an approved amount for every service there is, but providers are able to charge up to 15% more than that Medicare approved amount. With Plan F and Plan G, those excess charges are covered by your Medicare supplement. With Plan N, you are actually responsible for those excess charges. Again, that's not very common. We don't see that too much, but that is one of the caveats, one of the differences with Plan N compared to Plan G or Plan F. So when can you actually get into one of these Medicare supplements? Well, your open enrollment, as it's referred to, really revolves around when you enroll into Part B. So once you enroll in Part B of Medicare, you have 6 months. So you have the month that you enroll and then 6 months after that to get into any Medicare supplement, any Medigap plan with no questions asked. Also, let's say you were enrolled in Medicare before you turned 65. Well, once you turn 65, you have another open enrollment opportunity. And again, that's 6 months after you turn 65 to 6 months after you turn 65 to get into any Medicare supplement plan, no questions asked. Now, if you miss that window, you can still get into a Medicare supplement, but you will be subject to medical underwriting, where they're going to take your health history into account, and so it's a little bit harder. So we will generally advise that if you're looking to get into a Medicare supplement, it's best to do it within that open enrollment window. It's seamless, no questions asked, and it's just a smooth process for you.
All right, thanks, Ryan. I just want to chime in here on this slide briefly. So I know we got a lot of folks on the phone or on the webinar from Connecticut, New York. Those two states are actually an exception to these underwriting rules. There's actually no underwriting, as of right now, at least, in those two states. So for these Medicare supplements, these are federal rules that we're describing on this slide, which apply to pretty much every single state. But I know we have folks from Connecticut and New York on. Those two happen to be two of the only exceptions where there's no underwriting. So these rules are not as concerning for the folks in New York or Connecticut, because you can enroll in a supplement at any time with no underwriting. All right. So we've covered a lot of ground so far around the different parts of Medicare, around when to sign up for Medicare, how much do you pay the government for Medicare. If you're in a higher income bracket, how much do you pay the government for Medicare? And, I just want to see if there's any questions, feel free to use the Q&A window again in the Zoom session for your questions. What we're going to get into next is it's called Part D of Medicare, which is the prescription drug coverage with Medicare. And there's a tool that we're going to do a live demonstration of, which is on the government website, that we use to help pick the most cost-effective Part D prescription plan. But before I do the demonstration, I want to walk through the framework that applies to all of the Part D plans that are out there. So the government defines these rules that you see on this slide, and all of the Part D plans have to follow these rules. So there's 4 steps, if you will, within Part D of Medicare. The first one is the deductible. And for next year, we're just going to talk about next year's numbers. The deductible can be up to $480. So that means these plans can have a $0 deductible, $200 deductible, but it can't be any higher than $480. Now it says the member pays all and the plan pays nothing. Well, that's not necessarily true. It's really for the higher tier drugs, the brand name drugs, for example, where that deductible would really come into play. If you have low cost, generic type medications, that deductible really shouldn't really have an impact on you, and it doesn't really apply to those low-cost generic drugs. After the deductible comes the initial coverage level. All right. And 85% of people on Medicare are not going to get past this initial coverage level, and their Part D coverage is going to feel very similar to like a group insurance or a pre-65 individual, where you're just paying a copay or co-insurance for your medication. It might be $5, $10, $40, just depends on the medication. However, if you have very expensive medications and they exceed $4,430 based on the retail cost of the medication, it doesn't mean you've spent $4,430, but the retail cost of your meds, if they exceed that $4,400, that's when you fall into the third step, which is called the coverage gap. It's also known as the donut hole. It used to be called the donut hole with Medicare, where you have to pay 25% the cost of the medication. All right. So I'm going to give you an example because this can be very confusing. I'm going to give you an example to help illustrate this. But again, this is only about 15% of people that get into this coverage gap with Medicare. But if you're taking any medication you see a commercial for, you're going to hit this coverage gap. All right. So if you're in that group and you're taking the brand name drugs, you're going to hit that coverage gap. So I'm going to use a popular heart medication, Eliquis or Xarelto. Those drugs cost about $500, $600 a month retail cost. So your copay for that Eliquis might be $45. So, and let's just, for example, say your plan doesn't have a deductible, just for simplicity. So you go to pick up the Eliquis in January, it's a $45 copay, February, $45, March, April, May, June, now you get all the way into September. All right, you're 9 months into the year and you go to pick up that same drug that was $45 every month, and now it's going to be $130. And the reason is you've now exceeded your initial coverage level, because that Eliquis, just that one drug alone, will get you 9 months times the $500 a month retail cost. Right now you're getting over that initial coverage level, the $4,400, and now you're in the coverage gap. So now you have to pay 25% of the $500 or $600 for that Eliquis, which is about $125, $130 for the while you're in the coverage gap. So it can be very confusing and also very costly for people that have these expensive medications. They've been paying one set copay, and then all of a sudden the cost goes up significantly. So that is the Part D donut hole. That's how it works. And I'm just using one drug to make it simple, but it's the total cost of your drugs. If you exceed that initial coverage level, that's when you have to pay the 25%, the cost of the medication. All right. Now, there's another step on the other side of the coverage gap, which is called catastrophic coverage. And that's there to protect you, so you're not stuck in the donut hole for the entire back half of the year if you have very expensive medications. So, one drug of Eliquis is not going to get you into the catastrophic level. But if you have something like Humira, which is, like $5,000 a month retail cost, that drug alone is going to get you into the coverage gap after 1 month, right? You're going to be paying 25% the cost of that drug. And the catastrophic level is there to protect you, so you're not stuck paying 25% for the Humira for the entire back half of the year. And the way you get into catastrophic, and once you hit catastrophic, you only pay 5%. So that 25% will drop down to 5%, the cost of the medication. Only about 4% of people reach the catastrophic phase, where, again, about 12% are going to be in that coverage gap. Now, how do you get from the coverage gap to catastrophic? And I caution you not to get too caught up in the details, because they make it even more confusing than it already is. It's based on a different number. It's called true out-of-pocket. If you're over $7,050 true out-of-pocket, that's when you reach the catastrophic level, where you only pay 5% for your drugs. Now, true out-of-pocket isn't what it seems. It doesn't mean you have to spend $7,050. True out-of-pocket includes everything you spent for your medications, plus it includes the pharmaceutical discounts for brand name drugs while you're in the coverage gap. So rather than get tied up in that number, or even this number, what I would tell people is if you have expensive medications, you're probably going to spend about $1,500 of your real money before you get into the coverage gap, and probably another roughly $1,500 or so to get into the catastrophic level. You're not actually spending $7,000 before you start paying 5%. You're probably going to spend about $3,000, and then you hit the 5%. All right. And again, we're going to show an actual example of this shortly, but I wanted to explain those definitions and the framework before we get into the live demonstration. So if there's any questions, again, feel free to use the Q&A window in the Zoom. We are going to shift gears now, and I'm going to stop sharing this this PowerPoint for a minute and move over to the internet browser to show the live demonstration for you. So just give me 1 minute here. Let's share this screen. All right, so you should be able to see my browser window now. And I'm going to zoom in a little bit so you can see it clearer. So the Medicare Plan Finder tool I'm going to show you now is how we pick the most cost-effective Part D prescription plan. So we do this for all of our clients when they first go on Medicare. And then also every year you get one opportunity between October 15th and December 7th to review your drug plan for the following year. And we send out reminders in September to all of our clients to get their latest drug list. And we rerun that drug analysis each year during this window. The tool that we use is available to anybody. So I'm going to show you, it's right on Medicare's website. You go to medicare.gov. And there's a blue button here, Find 2022 Health and Drug Plans. You click that, and this takes you into the Medicare Plan Finder tool. You have two options here. If you have a mymedicare.gov account, you can log in to your account. And the benefit of that is you can save your drug information. So you don't have to keep re-entering it in every year or every time you want to run this analysis. If you don't have a login, you can continue without logging in, which is what we're going to do for purposes of the example. And the first question it's asked is, which type of plans are you looking for? For the purpose of this example, we're looking at Part D prescription plans. And then you enter in your zip code. I'm going to put in our office here in Cranford. You select, I don't get, this is if you get any help from Medicaid or other programs. For this example, we're going to say I do not get any extra help from Medicaid. And then you click next. And then it asks if you want to enter in your drug cost, drugs to see the drug cost. We do want to see a drug cost. So we click next. And now we get to enter in the medications that we're using. All right. So this tool, what it's going to do, it's going to look at all 25. There's roughly 25 different Part D plans to choose from. And it's going to look at all 25 based upon your specific list of medications. And it's going to calculate the total cost for the year, which is the premium plus the cost of the drugs for each of those 25 different plans. And then it's going to sort the list. And the one at the top of the list is going to be the least overall expense for the year. And in most cases, that's going to be the best plan for that individual for their Part D coverage. So I'm going to just put in a couple of medications. You can see you start typing in the medication and it pre-fills the list. So that's, if you don't actually know the spelling of the drug, it'll kind of start to fill it in. So a pretty common cholesterol medication, atorvastatin, 40 milligrams will take once a day, which is 30 per month. All right. And then I'm going to add another drug, just a common blood pressure medicine, Lodipine. Let's do a brand name. We'll do Coreg. Put in a brand name drug. And what happens, the tool pops you the generic is available. So most of these plans, if there's a generic available, and it depends on the medication, but most drugs they're not going to cover the brand name on any of these plans if there's a generic available. There are some exceptions to this rule. Drugs like Synthroid, where the brand name is covered, even though there's a generic alternative. But there's very few exceptions. In most cases, if there's a generic available, they're not going to cover the brand on any of these plans. So we're going to select the generic drug for this example. We'll just take the default dosage once a day. And now we have the two medications. For this first example, just a simple, those two medications. And now we have to put in our preferred pharmacy. So each of those Part D plans is going to have a preferred pharmacy network with different pricing and drugs at the different pharmacies. So I'm just going to select, you can do up to 5 pharmacies. Mail order is one of those. So we'll do mail order pharmacy. I'll take a couple of local pharmacies and then a couple of big chains, Walgreens and CVS. And we click done. Now the tool is doing all that work. It's doing all those calculations for us. There's no way we would have time to go through 25 different Part D plans to try and figure out what tier the drugs are, what the cost is going to be for these drugs on each of these plans, and then calculate it out, add in the premium, and figure out which is going to be the best. The tool does that all for us. And in this example, the plan that comes up most cost effective is this. It's called Humana Walmart Value. You don't have to use Walmart with this plan, but that's just the name of the plan. Walmart is a preferred pharmacy, one of the preferred with that plan. But regardless, this is for those drugs that were entered, this plan came up most cost effective. The premium is $22.70 a month. The deductible is $480. But the total cost is what sorts the list, which is the premium plus the cost of the drugs, which comes out to about $1,600 for the year, which includes all of that into that one number. If you start scrolling through the list, the next plan that shows up, you can see it's a higher total cost for the year. This is a Cigna drug plan, and then another WellCare drug plan. It's a lower premium, but the total cost, which includes the premium and the drugs, is higher for this, for this example. Here's another, the lowest premium plan, which is $7 a month, but the total cost is higher. So the drug cost must be higher on this for these medications. All right. So you just keep scrolling through, and that's, you're going to see that number keep going up and up as far as the total cost for the year. If you go to the very last page, for example, we're going to see that over $4,000 for the year for some of these, even the more expensive premium plan still has the highest cost for these, for this particular example. So I'm going to go back to the first page, and we're just going to go into more detail about that first plan that showed up. And this tool gives you a lot of great detail, but it shows now for the plan, the information we entered, again, the premium is $22.70 a month. The total drug cost at the pharmacy is about $1,300. That's for the year. If you use mail order, it's about $1,100 for this example with this plan. And if you keep scrolling through, it gives you some more information about the pharmacies we entered. This one, none of these pharmacies are considered preferred other than the mail order with this plan. So we're going to see the mail order costs are going to be lower for those drugs. Then it breaks down the annual cost of the drugs by each of those pharmacies. So you can see, what the cost would be, pretty similar for most of these pharmacies, and then a little bit less expensive for the drugs if you use the mail order program with this plan. All right. Next, it gives you the detail as far as when are you going to, well, first of all, what's that total yearly drug and premium? Remember, this was that number on the first page that brought this plan to the top of the list. So this includes the drug cost plus the monthly premium for the year into that one number. So we can figure out which is going to be most cost effective. So that's that number. When are you going to meet your deductible? Tells you you're probably going to meet that around March with this plan. You're not going to enter the coverage gap. Remember that donut hole or coverage gap we talked about? In this example, this person's not going to reach the coverage gap. We're going to do an example next where you can see the coverage gap and even catastrophic. You'll see that show up here. The next table shows us by month what our projected costs are going to be for our drugs. Okay, so you can see the first few months here, it's pretty high, right? Why is that? Because of that deductible. You have that $480 deductible for the higher tier drug. That Coreg is going to be a higher tier drug in this plan. And that's why you see the bigger cost there. And then by April, after you've met the deductible, the drug cost comes down and you're paying about roughly $90 a month for the medication. Yeah, you can see here, this dosage of this drug, the retail cost is showing $172. And the cost after deductible is that $84 copay, plus the $7 for the other drug comes out to that roughly $90 a month. And that's where you see, the, which plan is 91, here it is. So you can see that number in that monthly chart is the breakdown of the cost for each of those drugs. So anyway, there's a lot of great detail in here. Just wanted, you to be aware of this tool and this information that's out there. I'm going to do one more quick example here, just so you can see for someone that actually reaches the coverage gap and even the catastrophic level, what that would look like in the report and how that affects the plan that shows up as well. We'll see if we remove. Let's get rid of this drug, and let's add in that Eliquis that we talked about. Put that in there, and this should get this person into the coverage gap. So it's just recalculating now based upon the updated drug information we just entered. A new plan is probably going to show up now as far as which is going to be most cost effective based upon the updated medication information. Now, some people say, well, how do I know? I can't predict what I'm going to be prescribed in the middle of the year. Well, we understand that. And we still recommend picking the plan based upon what we know right now. And the reason is every one of these Part D plans has to cover at least 2 drugs in every therapeutic category. So even if you get prescribed something in the middle of the year, there's a high probability it's going to be covered on any of these Part D plans. And if for some reason it's not covered, you can always, you have 2 options. One, you can go back to the doctor and see if one of those other 2 medications would work. The other option is the doctor can file for an exception to get your medication approved if those other 2 medications won't work for you. So for those reasons, we don't ever recommend picking a plan based upon the unknown. You could pay $100 a month in premium for these drug plans, and there's no guarantee it's going to provide a lower copay for your prescribed medication than the plan that's $12 or $20 a month. So we pick the drug plan based upon what we know at the time that it's being run. So this example, we put in the Eliquis. Now it's a different plan. It's WellCare value script that shows up, lower premium. Total cost for the year is about $1,500. You can see if you scroll down, the next plan is $1,600, and they just keep going up. But let's look at that detail for that WellCare plan, so we can see the total cost for the year. Again, the drugs, the premium. It shows us the pharmacies. So the preferred Walgreens or CVS, the local pharmacies are in network, but they're standard pharmacies with this plan. The drug cost, again, for the year based upon each of those methods of getting the drugs. Then this is the table where it shows we're going to reach that coverage gap, right? So you're going to meet your deductible in January in this example because of the Eliquis, and you're going to reach the coverage gap in September with the Eliquis. All right. So remember that the retail cost of that, I'm going to show you, it's about $500 something a month. So that's why you're reaching that coverage gap about 9 months into the year. And that's when you have to pay 25% the cost of the drug. So now we can see in this example, you're reaching that deductible. It's a big month in January. You're paying a lot. Then you get to the initial coverage level where you're just paying the copay. Happens to be about $42 a month. And then you reach the coverage gap. And you can see that your price just went up. You're paying 25% for that Eliquis now, $130 roughly a month for the rest of the year. And let's just look at, so you can see there's that full retail cost for 1 month supply, which is why you're reaching that coverage gap in this example. So your copay is only $42 a month, but then when you get to September in this example, you're paying that 25% for the Eliquis. All right. So those are the 2 examples I wanted to just show, just to give you a feel for this tool and how it works. It's a great, powerful tool with a lot of great information in it to pick the most cost-effective prescription drug plans. Again, if you have any questions, feel free to type them into the Q&A window as I go back to the PowerPoint here to quickly recap some things for you. So just give me a minute. All right, so we should be back now. You should see my screen again, the PowerPoint. And I just want to quickly touch on, there's a couple of other programs out there for folks. These are not Part D prescription plans. So when you go on Medicare Part, when you're coming off of the group insurance, for example, and you're enrolling in Medicare, you have to have prescription coverage, credible prescription coverage. So it could be from, like, if you're a VA, veteran, you've got VA prescription benefits, that's considered credible. But for most people, it's going to be a Part D plan, prescription coverage, which is what we just showed you on how to pick the drug plans. These other services that are out there can be used in conjunction with but they're not going to replace the Part D coverage. If you don't have a Part D plan or creditable drug coverage, the government will charge you a penalty. It's a 1% penalty for every month you don't have a Part D prescription plan when you're supposed to have it. So if you waited 2 years or 3 years, you're going to pay a 24% or 36% penalty on your Part D premiums for the rest of your life when you end up enrolling in the drug plan. So we definitely recommend, even if you're not taking any medications, you should at least get that lowest premium plan. It's $7 a month, roughly for that. This year, at least, it's the Silver Script plan. And what that'll do is at least avoid the penalty. And if you do get prescribed an expensive medication, you're going to want to have some coverage to help offset the cost of that medication. Now, this slide shows some other coupon services, if you will, that are out there that can help bring your drug costs down. Even with the Part D plan, there's some medications that you're going to find are lower cost on these websites than your Part D prescription plan. One of the more common ones are the Cialis type medications. They're covered on some of the Part D plans, but the copay is very high, where you could get them with these coupons for maybe $5 or $10 a month, for example. So that's one example, but there's others out there as well. Again, this does not replace your Part D. I don't recommend just doing coupons from these sites because if you get a very expensive drug like the Humira or the Eliquis, these coupons are not going to be very helpful, right? These coupons are helpful sometimes for those lower cost, less than $100 a month type drugs. But if you have those really expensive drugs, you're going to want that Part D coverage to offset the cost. There's also, in each state has their own little programs for these income. If you're in a lower income bracket, where you can get prescription assistance, where some of them pay for your Part D premium, and most of them give you significant discounts on your medications, which will help folks that have expensive drugs that are in a lower income bracket. So these just happen to be the two examples in New Jersey, but each state has their own different state assistance programs. All right. So that is the prescription section of the presentation. Now I'm just going to quickly recap the top 5 mistakes people make on Medicare. So the number one biggest mistake is not enrolling in Medicare Part B on time. All right. So if you don't have other creditable group coverage, you're not working at a large company, when you turn 65, that window around this initial enrollment period, that 7-month window that Doug described, the 3 months before your birthday, the month of, and 3 months after, that's your initial enrollment period. You have to sign up in to avoid penalties and delays. Again, that's if you don't have the group health insurance, right? So we see people miss that window and they don't have other coverage, or they're on COBRA coverage after 65 and they think that's sufficient, where it's not, because if you're past the age of 65 and you're on COBRA coverage, you have to have your Medicare A and B, or you're going to have penalties and delays with your Medicare coverage. So that's another example of this not enrolling in Part B on time. The flip side is also true. I think Doug mentioned an example. We see this all the time where people are working past 65. They're at a large company. We see it with high earners. They're making a lot of money and they're paying a very high IRMAA amount, that, those high Part B premiums and income adjustments that Doug went through. And they're still working at a large company and they don't need the Part B. And for years and years, they've been paying this. And we find, they call us when they're 70 or 75 and they're going to be retiring. And they tell us they've had Part B all this time. And, some cases it's tens of thousands of dollars in premiums they're paying the government that is unnecessary. So that's kind of the flip side of this, which is enrolling too soon in Part B, where you're overpaying for those premiums for all that time. The second biggest mistake we see people make is not analyzing their prescription drug costs. We looked at an example, a pretty simple example, where the plan that came to the top of the list was roughly $1,500 for the year. And the one at the very bottom of the list was over $4,000 for the year between the premium and the drug costs. So picking the wrong Part D prescription plan can definitely cost you thousands of dollars if you have expensive medications. There's about 30 different drug cards each year to choose from. We recommend that tool on Medicare's website, which is called the Medicare Plan Finder tool. And again, it's available to anyone. You can use it yourself. I don't recommend going to an insurance company directly and asking them to help with this analysis. If you call up an insurance company, they're going to do this for you, but they're only going to look at the 2 or 3 options that they have available, right? If you go to Medicare, the Plan Finder tool, it looks at all 25 of the options across all the different carriers to find the most cost effective. Whereas, you know, the particular carrier is only looking at their 2 or 3 plans. They're not going to tell you, well, you should go to this other carrier to get their drug plan. So definitely don't recommend that, calling the carrier directly. Also, when you first go on Medicare, you get to do this analysis, but then every year you get an opportunity, October 15th to December 7th, to review the drug plan for the following year. Even if your drug list does not change, these plans change every year. So your drug may no longer be covered, or might be a higher copay, or, you know, this year one of the plans was getting canceled and the carrier mapped it into another plan that is over twice the cost in premium. So it went from something like $24 a month up to $70 a month. And if you don't do anything, you're just going to have to start paying that higher amount the following year. So even if your drug list does not change, we recommend reviewing this Part D plan every year. And again, we send reminders to all of our clients in September to get their latest drug list and rerun this to make sure they have the right Part D plan for the following year. The third biggest mistake we see people make on Medicare is not understanding the differences between Medicare Advantage and Medigap, 2 very different types of coverage. All right, and Rod went through the different examples and the differences essentially between these two flows. And the Medicare Advantage, remember, that's the fully privatized option. The insurance company is taking over your Medicare benefits. When you sign up for those Advantage plans, you're no longer on Medicare. Now you're on United Healthcare, Aetna, Blue Cross, or whatever carrier you sign up for is now fully administering your benefits. Those Advantage plans are the ones you see all the commercials for, right? The Joe Namath, the Jimmy Walker, George Foreman, who's the other one now? William Shatner now, right? So they're promoting those Medicare Advantage plans. They can throw in extra benefits, right? Dental and vision vision exam, and rides to the doctors and so forth in those Advantage plans. The core medical coverage within those Advantage plans, most of them are HMO type plans. So you've got to go to certain doctors and hospitals. It's managed care. The insurance company is making decisions for you, whether or not you need an approval for that MRI or a prior authorization, or that's being controlled by that insurance company. The premiums on those Advantage plans are much lower. You can get a 0 premium Medicare Advantage plan. Most people, if they're enrolling in the Advantage plan, are going with a 0 premium, but the out-of-pocket cost is up to $7,500, $7,550 per year per person on those Advantage plans, right? So just very different than the supplements, which Rod reviewed that as well. The Medicare supplements are the federally regulated coverage, so the government designs those supplements, and then the insurance companies just administer the plan. And it's exactly the same coverage regardless of which insurance company you get it from, and it's just supplementing Medicare. So with the supplement or Medigap plan, Medicare pays its 80%, and then the supplement essentially pays the other 20%. So 2 very different types of coverage. And this is the third biggest mistake, is people that just don't understand the differences between these 2. Some people are enrolled in a supplement. They think they have Advantage, or they're in an Advantage. They think they have a supplement, but they're 2 very different types of coverage. We have a question that's come in from Susan. If you enroll in a Medicare Advantage plan, then after a few years decide you want a Medicare and a supplement, is there a penalty? There is no penalty in that example. In most states, however, you would have to go through medical underwriting to get into a Medicare supplement after that open enrollment period. Rod went through the first 6 months. When you enroll in Medicare Part B, your 6-month timer starts for a Medicare supplement open enrollment, where there's no medical questions. You can get any supplement you want during that 6 months with no medical questions. After that 6 months, so you go to the Advantage plan for a few years, and then you decide you want to get into a Medicare supplement. In most states, you'd have to go through medical underwriting. So if you're living in Florida and you're in that example, you'd have to go through medical underwriting. So you may or may not be able to get approved for a supplement. Each carrier has about 10 to 12 different knockout questions. And if any one of those is a yes, you cannot submit an application for a supplement after that 6-month period. Now, again, I said this earlier, New York and Connecticut are the two exceptions right now, at least, where they do not have medical underwriting. So you would be able to just get into the supplement in those states with no medical underwriting. So I hope that helps. Susan's question. All right. So let's go to the fourth biggest mistake we see people make on Medicare. So not analyzing retiree health plans. So, in most states, a teacher that's worked for 25 years gets very good retiree health benefits. They don't pay any premium. And, it's in their best interest, most likely, to keep that retiree plan. However, there's other companies out there or a teacher even that teaches for a few years below the threshold, 22 years, that may have to pay $400 for that same retiree benefit, right? In that case, they may be better off getting their own supplement and drug plan that might cost $200, and be better coverage for them. So we see this a lot where people think they've got a benefit as a retiree plan. Verizon, just used to offer these retiree plans, or Bank of America, J&J. A lot of companies are getting away from these plans, or they're continuing to kind of cut the benefits, increase the premium, and it may not be in your best interest to stay on those retiree plans in those examples. Now, if you're paying zero premium and you've got a good retiree plan, it's probably good for you, but not analyzing the one where you're paying more is the fourth biggest mistake we see people make. And the fifth biggest mistake we see people make on Medicare is listening to your friends and family. And we joke about this, but we see it all the time where people are making decisions or calling us saying they want a particular plan because their neighbor, their cousin, their spouse has a certain drug plan, for example. And the reality is Medicare is individual coverage. There's no more family plans. You want to pick the best coverage for your specific situation, not based on what someone else's experience is, unless they're taking the exact same medications, for example, and going to the same pharmacies. It may not be the right plan for you. So we have another question that has come in. Is there a supplement plan for vision and dental? So I want to be clear about the terminology here. So the question supplement plan, there's not a supplement per se. There's Medicare Advantage plans can include vision, a vision exam, for example, dental cleanings can be included in those Medicare Advantage plans. Medicare supplements can only supplement Medicare. So basically, if Medicare covers something, the supplement has to cover their portion of that service. But if Medicare doesn't cover something, the supplement will not cover that service. And as of right now, Original Medicare does not cover your basic vision and dental services, so the supplement will not cover those either. Now, if you need medically necessary vision, things like cataracts, glaucoma, wet macular degeneration, those things are covered by Medicare Part B, and therefore they would be covered by the supplement, but not your basic vision exam or eyeglasses or dental work. There are individual plans that you can get, separately for those services, for individual vision and dental plans. Depending on where you live, the value of those plans, what you're paying in premium and what you're going to get back in potential benefit might not be a huge value. When you look at, again, how much you're paying out and what you could potentially get back. So a lot of people end up self-insuring, if you will, for those other services, and they just pay the dentist directly rather than paying a premium for those services. So I hope that helps with your question, Jen. All right. And that is essentially our presentation. I'm going to give it a few more minutes. I'm going to recap just what we do again while we wait to see if any other questions come into the window here. But we're essentially brokers for the Medicare plans. There's no fee to work with us. Basically, we work with all the A-rated insurance companies that are out there. And if you have any questions about Medicare, we're happy to just help you with your questions. If you're considering enrolling or you're ready to enroll in Medicare, we can help you with the different options that are out there and help you enroll in those plans. You're going to pay the same premium, whether you go directly to the insurance company or if you work with a broker like senior advisors. So there's no cost to you to work with us. Obviously, we'd love for you to give us a call or send us an email when you're ready to enroll, or just if you have questions or you want to do a comparison. Should I stay on the group plan, or should I be going and getting my Medicare set up? We can help with those comparisons as well. Yeah, Susan, we'll send out the PDF of the slides after the presentation. Yes. And we'll give it another couple minutes and see if we have any other questions. And I want to thank everyone as well for joining the presentation tonight. We hope you found it informative and helpful with your planning when it comes to Medicare. And we have other resources out there. We've got a ton of videos on YouTube. I recommend you subscribe there. When something new happens with Medicare, that's kind of the first place we post it. It's the quickest way to get the information out. And, if you subscribe to us, you'll get those updates quickly there, or follow us on Facebook. You'll get those updates there as well. So we'll give it one more minute and see if we get any other questions. And when I was drinking, this is not a beer, by the way. I think you saw me drink out of a can earlier. It's some sort of mate tea thing. I need a little caffeine, so just want to be clear about that. There might be beers later, but not during the presentation. All right, I don't see any other questions coming in. So once again, thank you everyone for joining, and we hope to hear from you when you're ready for your Medicare planning. Take care, everyone. Have a good night.